going in the body, and then also the weight on, you have to have the weight loss, so that ultimately you can take diabetes away. You can't.
Well, what about childhood diabetes? That's one of the real problems that we've had
Well,
in this particular area.
it's a big problem, and it's more complicated because you have a family. You don't just have one person in the clinic.
Okay.
So, you know, that's tough. But the same equation occurs, so that if you're eating too many calories, and if the calories are from sugar, you have to reduce the sugar. So I like people, my other dream is that to lose weight, you don't just decrease the fat. Everyone says, oh, I know I need to decrease the fat. No, no, no. If you're eating too much sugar, you have to decrease the sugar. If you're eating too much potato, you have to decrease the potato. So the pediatric obesity is a big problem, and we're seeing diabetes in children, and the pediatricians don't know how to manage it. So at Duke, we have a specialty center for pediatric obesity and diabetes now. So that's a bad sign. It can be turned around by attention to what goes in the mouth, the food and the drink. But you know, if you have ever had a teenager, the battle is a little harder than as an adult, just treating one patient.
You know, Doctor, in looking at some of the major issues that you find in treating diabetes, what would you say would be the national impact of these diseases upon our national budget? If we were able to eliminate these as diseases, how would that affect our budget?
Well, there have been, it's tens of billions of dollars in healthcare costs. I don't know the figure exactly, but
that would
huge.
be a real cost. We would be able. What about dialysis? How much does it cost to keep an individual perhaps over?
Very expensive. I think $25,000 to $50,000 a year. So if you can avert one dialysis patient or delay it, this is a very important way to save money.
And of course, when young children get caught up on that and they have to go on to dialysis, they have to go on at an earlier age.
Well, this is the fear. I don't know of those cases yet, but that's the projection, that we'll have people on dialysis at early and early ages because of the diabetes.
And so there's nothing that, well, is it just education that we have to continue to pump at people in reference to these diseases?
No, there's been a lot of education. You know, this has occurred with people who are working hard, working at this. It's kind of like smoking. It's complicated. There are the environmental things that have to change, so that you can't have all of the calories available everywhere. When I grew up, we didn't have vending machines everywhere. And now it's so easy to get that. The type of food matters. I just want people to go back to eating real food. You know, food that doesn't come in a box, in a package, with processing, that sort of thing. And they're going to be a lot healthier.
Very good. And of course, your clinic is devoted to that, and it's working off of a grant that you received from the Atkins Foundation. Is that?
We use grant support, but also insurance is paying for this now. That's the other thing doctors need to know, is that insurance is coming around, and you can actually treat people this way and get reimbursement for it.
And so there was some fear that that the insurances would not pay for that kind of treatment?
For many years, they did not. And if you just put obesity down, you wouldn't get paid at all. So that's a big issue, and that fortunately is changing.
Well, it would seem to me that if a company is involved in insurance, what they would want to do is to prolong life as long as possible. And if it does appear as if there's something that you could do by way of diet in order to prolong life, they ought to be in favor of doing everything that they possibly could to cut down on obesity, the sugar, and et cetera, and et cetera. It seems to me, Doctor, and again, I'm not on a soapbox here, but it does seem that if our medical people are not doing us a great service unless they talk about these kinds of things, you see. And I'm not charging anybody or whatever, because I think that we see too much information on the television every day about diets and et cetera and et cetera. And so the population is aware of what the diet is doing in terms of their appearance. They might not be aware of the health. And I think if we could bring that health and appearance thing together, we might be more successful in doing so.
Well, that's the idea of merging lifestyle medicine in the name of a clinic, because we're talking about medical problems, diabetes, kidney failure. These things are serious and
Very
costly.
good. And of course, Doctor, let me thank you for coming by and giving us that excellent information. And as we said before, we know that our audience will be informed by some of the things that we've talked about. And of course, let me also encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.